So we are talking about repetitive overuse injuries today, also known as PARS injuries. They're most often caused by repetitive stress, and they are more common than ever today with young athletes who specialize in a sport. We're talking about football, wrestling, cheer, diving, dance, honestly, any activity that young athletes are training in and playing hard in. So what do these injuries look like, and what can you do about it? A lot of people want to know this. We have two specialists here today to talk about it, VSI spine surgeon, Dr. Colin Haines, and VSI sports medicine physician, Dr. Niteesh Bharara. Thank you both so much for being here today to talk about this.
Thanks for having us.
So I want to set up our conversation briefly just with a little more background. We know that more than half of all kids are participating in a sport. The youth sports industry has become more popular and more in demand, more intense. You both are fathers, you know about that, than past generations. A lot of kids are in training, playing one sport year round, which means it's a lot on growing bodies. Like I said, this is an issue many parents are thinking about, including myself and both of you. So let's start with the concerns that you both have about this level of play for young kids. You each have three kids, right?
Three girls, same age.
Three girls, same age. So talk about the experiences with your kids. Are you changing how you approach sports with them and even yourselves because of what you've seen among your patients recently?
So, I want to start with saying this is a good problem to have in the sense of that sports are good. We want our kids being physically fit. We're not doing a bad thing by keeping our kids active. Both Dr. B and myself. So our kids, same age, good friends, 8, 6, and 2. And we're seeing different conditions, different potential issues with each of them. As we get older and older, you mentioned that, or our kids get older, you mentioned that we're specializing so much. I feel like our kids are becoming young professionals. And that's a very different analysis than it once was. When I played, I did soccer, basketball, and tennis. And I did it based on the season. So I was able to give my body more rest. Each sport has different potential injuries that come with it. And once you're able to rest more, you kind of heal up and move past that. But now a lot of my kids are getting into, my kids' friends are getting gymnastics, 10 hours a week at the age of 4. Right? It's a great exercise. It's a great sport. That's a lot of force, and that's getting in very early without giving your body a break.
Dr. B, same deal for you?
Yeah, absolutely. That's exactly how, when I was growing up, every sport had a season, and that's not how it is anymore. Now what it is our kids will play one sport and then they'll play that sport year round. That's good in that they become very good at that sport. But what it does to the kid is it puts a lot of stress in the areas over and over and over again. So they get these overuse injuries. And so they don't really get to cross train and work the rest of their body. In kids, they're growing at a very, very, very quick pace, and their bones are outgrowing their muscles, right? And so when you're overworking parts of your body, you're really prone to injury. And these kids need to be able to really become athletic, not just become athletic in one sport. Mm-hmm. And athleticism comes from working multiple different muscles. And so it's very important for them to really grow into their body. But also there is a large amount of mental health help when it comes to playing sports. There's a socialization of things. And we're seeing that we're seeing kids move away from that aspect of it because they're so specializing so early into a specific sport.
So with what you're saying, does that make you set parameters for your kids on what they can and can't participate in?
Well, I guess, I'll start with that. In an ideal world, I see a lot of injuries. I see a lot of gymnasts getting injured. And it's not that it's a wrong thing. I see a lot of cheerleaders getting injured. And it's not something that's wrong. One of my daughters sprained her wrist. She's totally fine, but she's doing a back bend. So my kids seem to gravitate towards cheer and gymnastics. That's something I think about a lot because I wish that weren't. I just wish they had a passion in another sport because I tend to see more spine injuries with that specifically, and I'm relatively biased in that I don't want them to hurt their backs. But with that being said, it's something I think about. It's not that I'm banning them from that sport because in general, I think that the benefits vastly outweigh the potential risks. It's just being smart about it. So summarize, you're not a bad parent if your kids are doing gymnastics. You're a wonderful parent, but maybe toning it down a little bit, I think, is a good thing to do.
Okay. So, Dr. B, let me ask you, what do PARS injuries look like?
Yeah. So a PARS injury is a overuse injury that we have in the spine. So usually we see it in children, but you can see it in adults as well. And the reason why we see it in children more is because they're growing at a very fast pace. So their bones are remodeling and their muscles are just not keeping up. And so it's very easy for these kids to get fatigued. And what happens is they put too much stress through a specific bone that's in the spine. And when you do that, you start getting injuries to it. And so that those injuries there's a spectrum of those injuries. There's stress reaction or stress fractures, meaning that it's not really fractured, but it's not stable anymore. And then all the way to a complete actual fracture of the spine. And that's what a PARS fracture, sometimes we call it PARS fracture, PARS reaction. You'll hear lots of different terms about it.
Okay. And Dr. Haines, you experienced a PARS fracture at one point in your career, didn't you, playing soccer?
I didn't have a PARS fracture. I had a common type of injury we see that can be potentially overuse. Mine was a disc herniation. So there's a subtle difference between the two. The bones, or when the bones get injured, that's more of that PARS fracture. When the shock absorber that lives between the bones, so-called the disc, that when that gets injured, that's what I had when I was younger. That's something that also for me was an overuse injury because, the way I like to think about the muscles with respect to the spine is the muscles are the armor for the spine.
Mm-hmm.
When the armor is not working well, the spine has to work harder. So for me, when I injured myself, my muscles weren't quite an idealized spot. They were fatiguing. I did a move that I probably shouldn't have done, and my spine took the force. So instead of injuring the bone, which is one type of stress fracture, injured the disc, which is another type of overuse injury.
Mm-hmm. Yeah, you talked about gymnastics. One of my daughters experienced a back pain, and we think it may be, we're digging into it, but thinking it may be a fracture. So I know how painful those can be. How often, Dr. B, does this injury end a young sports career?
Well, I want to go ahead and mention that, gymnastics is not a bad sport, despite that we see a lot of these injuries in gymnastics, or we see it in potentially tennis and swimming and soccer. These aren't bad sports, and there is a lot of benefit from being a gymnast. Flexibility is extremely important. The challenge of it is many times in these days, coaches will push kids to train for 6 hours a day, 6 days a week. That's a lot on a child's body. So a sport is not a bad thing. It's how we go about actually playing that sport. And so many of these kids that we see that do get these reactions will have a tremendous amount of back pain that's associated with it. And what they do is they fight through that back pain, right? So they fight through it and they don't stop. And because they hear from their friends that we should continue to play, right? They enjoy it. I see it in my kids all the time. They love to go dance, and so their dance instructor, who is fantastic, they have her doing it twice a week, and some of the kids there do it 4 times a week, and it's just a lot. It's a lot on the kid's body, and you really start wondering, at what point do these kids just say that they love to do it, and so they won't tell you that they're actually injured, and I think that's what we see a lot of.
Right. That's a really good point. And my daughter, actually, she's 17. She had to quit her gymnastics, then competitive cheer career because her back was in so much pain. So I am curious though, how often are these sports ending injuries, and can they come back from them fairly, easily? I don't know. Dr. Haines, can you answer that?
The good news is, and I'm so sorry to hear that about your daughter, but most of the time we're able to get kids back to their normal functional activity. So I would say with the proper diagnosis and the proper treatment, it's actually relatively uncommon. It's not a 0% chance, but it's really, really low. There are a lot of kids that both Dr. B and I see that were told, hey, you can't do anything, you can't live life the way you want to anymore, because the only option was surgery, right? I'm a surgeon. There are surgeries that can help with this. But the good news is, as a surgeon, as a sports medicine specialist and regenerative medicine specialist here, we can actually get people better who have these conditions that used to be tricky to beat, You just got to diagnose it properly and then treat it appropriately. One of the ways that we can do this very commonly is regenerative medicine nowadays.
So, Dr. B, why don't you talk about that? Because that's the non-operative solution that you can provide for these kids and adults who experience these injuries. What is the best course that you suggest for your patients? Is it stem cell therapy? What is it? You talk about it.
Well, I'll tell you that just like Dr. Haines said, I mean, we're able to get these kids back to playing their sports pretty quickly. But the most important thing we do is we figure out what's wrong early, and that comes from a lot of different ways. It comes from the child, one, telling us that they have an injury, and then the parent recognizing that this could be a problem and getting them to the right physician to make that diagnosis. So, early treatment is the best form of treatment, because the longer we go with the stress, maybe a stress reaction, just there's some extra force on that bone to actual real fracture, we're able to get people back earlier and faster if they just have that stress reaction and not a true fracture. And so we're able to get these people back initially with physical therapy. We really change what they're doing. Maybe let things relax, calm down, and then get them into an exercise program and a return to play program for them. Then there's other situations when there's a true fracture that we may end up having to do other things, such as regenerative medicine, stem cell therapy, and help that bone actually regrow back so they have some stability in that area.
And for those who don't know regenerative medicine at all, could you just explain really quickly? It's using the body's own tissues to heal itself. So how does stem cell therapy work?
Exactly. So in these situations, we use stem cell therapy when there's actually truly a fracture there. And what we do is we take stem cells from your own body and place it directly back into where that fracture is. And what that does is it causes and helps the bone reform there. And so we use the patient's own their own body is their intent, and they want to heal. So we kind of force that to heal by placing stem cells in there and allowing the bone to actually form.
Okay, and that's not just for a pars fracture; it can be for any overuse injury, right? What other parts of the body can you do this on?
Well, we use regenerative medicine for lots of sports injuries: Achilles tendonitis, Achilles tears, rotator cuff tears, labral tears in the hip, knee osteoarthritis. So you can treat. We use regenerative medicine for lots of different sports-related issues, orthopedic conditions.
All right.
It would have been good for my disc and my back. If that persisted, I would be a perfect person to try regenerative medicine. I've just been very fortunate that has not persisted. In that small subset of people, there are many conditions outside of the spine and within the spine that can be very effectively treated with stem cells, PRP, all forms of regenerative medicine.
So if that regenerative medicine doesn't work, then Dr. Haines, how often are young athletes coming to you for surgery? And is surgery the answer for some of these kids with repetitive injuries?
It may be, but I have a lot of kids who come see me and they say, I'm ready for surgery. And we say, actually, we haven't done all the non-operative treatments. And then we do regenerative medicine, and then they get fixed. For these, very specifically for the stress fractures in the back, I've probably treated about 50 patients with regenerative medicine, and only one of them didn't heal. It was no fault of her own, but just like Dr. B mentioned, you want to get this caught relatively early. By the time she saw me, the gap in her bones was so significant that despite us trying stem cells, it just wasn't potent enough. So she required a surgery, and she's doing very well, but it's because we just caught it too late.
And I think one thing that we see, like Dr. Haines mentioned, is that we really need to treat these patients early. But we see a lot of patients that come to us and say, "Oh, I had a pars fracture and I tried everything and nothing made me better. I'm ready to move forward with something surgical." Right? And then you go through their treatments, and really what they've tried is they've tried to rest it, they tried to brace, and then that's it. And that's not really the way to go. There's a whole protocol that we have that we go from the beginning of really adjusting their play, their exercise abilities, and then we take them all the way to the point where they can actually get back on the field. So unless they've really exhausted all those options, we usually don't move forward with something surgical. And the most of the people that we do see, especially outside of our practice, they really haven't gone through that protocol. And because when they do, most of them are able to get back on the field.
Okay. So, and I think you call that the return to play program. What is that timeline? I would imagine that it's different for every person.
Well, that timeline, it's individualized, and that's the most important part of the program, right? It's not this is a 2 to 4 week program, or this is a 6 week program. this takes into account how each day the individual, the athlete is how they feel. And so this program may take 2 weeks for somebody. It may take 2 months for somebody. And so it's very individualized. And if you don't have an individualized program, usually that probably won't work because we're not taking into account their type of fracture, what they do, what sport they play. These are all things that are very important in making the decision on when they should be able to return back to their sport.
Okay, thank you. And Dr. Haines, both of you have talked about catching it early. But we've also talked about how kids say, "Oh, I'm not injured," not, really not admitting it or understanding that they may actually be injured, that it's not just pain. What should, Dr. Haines, let me start with you. What should kids look out for or parents look out for? And what's the differentiation between just occasional pain or a PARS overuse injury?
Occasional pain is much more reassuring. I mean, all of us have strained our back a little bit, tweaked a muscle, or worked out too hard. But when it's a constant pain, when it's something that doesn't feel right, it's kind of a subtlety, but I like to say there's between a hurts so good, like a good workout, like a muscle strain versus ouch, this just plain hurts. When it's that this really hurts, that's something to get checked out. It's more common for someone who's 75 to have back pain. Someone who's 7 or 17, aside from an occasional flare, it's not nearly as common. So that's why we're very much in the mindset of saying, hey, if your child has a pain, don't rub some dirt on it. If it doesn't feel right, definitely get it checked out.
Yeah. A teenager shouldn't be having constant back pain.
Constancy that's a problem in general. It's something that, while it doesn't mean you're rushing to surgery, it just means, hey, let's get this checked out so you don't have to rush to surgery someday.
But I also think that it's really important that the parent is looking for these signs, because most kids, their pressure comes from a lot of different places. They come from the other kids that they're playing with. They come from their parents. They come from their coaches. And so it's really important that the parents actually look for these signs. If they are withdrawing from the sport, like they decided they don't want to play as much, there may be something more to that, right? That could be that they're injured or they're hurting, right? If we notice swelling in an area, they may not say it's hurting, but there may be swelling there. And so it's really important that the parent is looking for these signs, because the communication isn't always there between the athlete and their parent, or the athlete and the doc.
Well, and you bring up the coaches. Do the coaches, and you may not know this, but do you find in the trend of seeing more of these injuries that are coaches paying close enough attention?
I don't think so. And it's not based on lack of caring. It's just, sometimes coaches are, we're in the age where we hurt ourselves, you just rub some dirt on, move on with it. I think a lot of times that's a coaching mantra, and it's not I don't mean that in a derogatory way. It's just that's kind of the way that oftentimes that generation of coaches were taught. I think that coaches truly care. They want what's best for them. But sometimes there's almost this, maybe adversarial is not the right term, but it's the coach's goal is to get the most out of their kid athletically and have their team perform. And our goal is longevity for that child. I always liken a stress fracture. It's like, you ever get one of those paper cuts in your fingers, like in between your fingers? Yeah. They hurt. They're unfun, but the worst part about them is you think you're healed, you reach, and then it tears and you start from the beginning.
Yeah.
That's how I think of these stress fractures and these injuries, that unless you let it heal, and that's why it's important to have such an individualized plan, but unless you let it heal, it can tear, you go back to square one. A lot of times it's very helpful in terms of navigating the emotions of these stress fractures and these overuse injuries. Having your doctor kind of be the bad guy. It's hard when a patient or a kid or a parent says, hey, I need to be out for a month. Mm-hmm. The coach says, are you faking it? Do you really care? When your doctor says it, there's really no ambiguity about that. So that's one of the things, the emotions we see a lot, both as parents, but also as physicians, trying to navigate that dynamic. It's actually really helpful having a doc to be the one to say, hey, here are the ground rules. Sorry, coach, we got to live by it.
That's the voice you're not listening to in your own head. So you've got somebody else to come forward and say, hey, you got to listen to your body. Dr. B, I know you had an injury too at one point from playing basketball, if I remember correctly. How were you treated and how are you doing today?
Yeah. So actually I was playing soccer, but I've had plenty of injuries playing basketball as well. But I've had, I had a meniscal tear in my knee playing soccer, and it was actually a traumatic injury. So it wasn't an overuse injury, but these type of injuries are they're injuries in itself. And one of the things I'll tell you that I did, I fought through that pain. I knew my coach would have been mad if I would have told him I was in pain. And I fought through it, and probably not the best idea in the world, and definitely didn't tell my parents. And so you get to a point where you start saying like, actually, I just can't do this. And so that's when I decided to see a doctor. Ended up needing something surgical. Going back and thinking about it now, I'm not sure I would have done that. But at that point in time, those were the options that were available. But if I would have honestly addressed it earlier, I would have probably gone through a physical therapy program, and it would have been a very different course of action for me. So, I think I look back at my own life and I say, I wish I would have said something. But as a child, you don't think about that. That's not what you're thinking about. You're thinking about how I can continue to perform, for the people around me, for myself, right? This is very important for me socially and for me mentally. And I see that in my kids as well. They'll push through almost anything as long as they can continue to have fun and continue to be around their friends. So I think that's extremely important for us parents to look for. I'm looking for it because I went through it.
So, moral of the story and the key takeaways, kids need to pay attention to their own body and really tune in on pain, constant pain versus just occasional pain. Parents need to be paying attention, and there are solutions. That's the good news. And I know VSI has a lot of them. So VSI spine surgeon, Dr. Colin Haines, and VSI sports medicine physician, Dr. Niteesh Bharara, thank you so much for your insight on this. A lot of questions answered today. Really appreciate you both.
Thanks, Laura. Appreciate it.
Yeah, thanks for having us.